This is Agriculture Today, and I'm Samantha Bennett with the K-State Radio Network. We begin today's show with a conversation on winter lameness in cattle from Dr. J's Beef Podcast. In this two-part series, we hear from K-State Beef System Specialist Dr. Jaymelynn Farney, as well as K-State veterinarian AJ Tarpoff. They discuss the many potential causes of winter lameness and stress the importance of not all cases being cases of foot rot. AJ also explains at what point a producer should call a veterinarian and the importance of differentiating between these different problems to lead to the best treatment option. We end with this week's Milk Lines, where K-State dairy specialist Mike Brouk has a recommendation for producers. He's recommending that producers evaluate the moisture and starch content of their 2022 corn silage to determine if it met their actual goals. That and more is coming up ahead on Agriculture Today. This is Agriculture Today. We're beginning today's show with a conversation on winter lameness in cattle. I figured this is a very timely topic, considering that most of the state this past weekend had a bit of winter weather. So with that comes concern over some foot issues in our cattle friends. So we're going to tune into a conversation now from Dr. J's Beef Podcast. So we'll hear from Dr. J herself, K-State Beef System Specialist Dr. Jaymelynn Farney, as well as K-State veterinarian AJ Tarpoff.
You know, we were just wanting to kind of address this winter lameness. And I guess I would to start us off. Is winter lameness different than our pasture summer lameness concerns that we have?
So in essence, the question is, are the lamenesses different? Obviously, I think it's a good place to start that there are multiple causes of lameness in pasture or confinement animals. Those causes can be a multitude. It can be infectious, like a foot rot that starts from some damage. It can be something like a hairy heel wart issue that's external. We can also have deep infections, toe abscesses, sole bruises. I mean, the list goes on and on. Now, are the causes different in spring versus fall or winter? No, actually, we have the same causes of lameness regardless of the time of year. However, we do see prevalence or the amount or number of cases kind of spike in different times of year. Everybody thinks about lameness and it's like, okay, during the summer months, they're standing in ponds and we end up with foot rot. Right? I mean, that's what everybody thinks about. So obviously high moisture, we get soft skin. Yes, we see, and we attribute a lot of that to summer months and grazing with foot rot. But we also have a very similar situation, except for being very wet. All of a sudden we have very rough ground that's frozen and we have scratches and abrasions to the feet as they're either grazing or within a pen. So we have environmental challenges, both leading to the same lameness called foot rot. Now, that's just one example. We have other causes of lameness, but that's one of the more common ones.
Let's go ahead and dovetail onto that. What are the other causes of lameness aside from those that you specifically mentioned?
Yeah, we can dive in a little bit more. It's the common thought process is every lameness is foot rot until proven otherwise, and that's not true. Okay, foot rot is a very specific disease that we have. Bacteria gets, it's a subcutaneous infection that we have it pop up. We have what we call symmetrical swelling. So both sides of the foot, the entire foot seems to swell out like a bell. So that is a very specific diagnosis. Now we have other issues like deep-seated infections. Think about the foot itself. We have skin that goes down to the hoof wall. We have the sole. And inside of that is really nothing but bone and ligaments. So there's not a whole lot of structure down there other than critical components. Now, if we get swelling and lameness and we don't have symmetrical swelling, say only one toe is swollen, that's not foot rot. That's actually a deep-seated infection in either the joint, the bone, or one of the tendon sheaths, or the tendon itself. So those are serious. Those are more malicious type scenarios that need different types of therapy. Not just an injectable antibiotic like we would with foot rot. They may need some either paring out an abscess in the foot itself. Might need some joint flushing by your veterinarian. There's a lot of different options out there. But if we see unilateral or one-sided swelling in the lower part of the foot, something should trigger in our minds that something isn't right. This is not regular foot rot. We need to see a veterinarian for that. So I kind of lump that into deep infections. Could come from the sole of the foot, but regardless, we have one of those deep structures, bone, joint, tendon. We have something more serious going on with that situation, not just a subcutaneous bacterial overgrowth. So that's, we have foot rot, we have deep infections, but then we have other things like toe abscesses. Think about if you're folks that are buying calves right now or bringing calves in from different parts of the U.S. They had a long truck ride, or maybe they went through some sale barn facilities. So anyway, we have new calves. Maybe they have pretty soft feet and they ran across concrete or some metal structure in the truck itself during transport. Those are situations, and especially if they're a little bit of flighty cattle, that they can actually wear down and we get abscesses in the hoof wall itself. So it's right at the tip of the toe. We end up with an abscess. That's right where the hoof wall and the sole come together, and it's called the white line. So if we wear down or have abrasion of that white line, we let bacteria into the hoof itself. Think about, have you ever, slam your finger in a car door or hit it with a hammer? Yeah. And so we think about that throbbing pressure underneath our thumbnail. Well, cattle, these toe abscesses and these kind of flighty yearling or calves up freshly on arrival, they feel that same throbbing pressure, except they have to walk on it. So it's a very painful condition. We try to, diagnose those as soon as possible. And so that lameness from a toe abscess from a freshly arrived animal, their lameness looks very strange. There is no swelling. We have an animal that's obviously very distraught. They're very flighty. They're very angry. They're painful. They can be dangerous to handle. I mean, I don't blame them for being that aggressive. I would not like to walk on that either. So it is a painful condition. We try to diagnose it as soon as possible. It's odd shifting lameness. It's usually the back legs and the outside toe that are most commonly affected. You'll see cattle shifting their weight. You'll see their back legs. They stand and they actually stand cross-legged with their hooves crossed. That is not a normal position for a bovine animal to stand. They should stand nice and square. These animals, they stretch, they constantly move, and they'll be off of feed, they'll be off of water. They look pretty rough because it's so painful to try to move around. So that would be toe abscesses. We talked about foot rot. We talked about deep infections. We talked about toe abscesses. Another one that pops up this time of year, kind of whether we're getting close to weaning or we have, some younger calves, newly arrived animals, if you're going to be running some stocker cattle through the winter, is joint infections. And this gets mislabeled foot rot all the time. We see a lame animal, it's packing a leg, and it's like, oh, it's got foot rot. But there's no swelling on the foot. The foot looks completely normal. And it's like, well, there's weird swelling up by the belly on the leg. And it's like, well, it's a swollen stifle. So it's big knee joint on its back leg. Sometimes it's the hock. Sometimes it's a front leg. But we see these joints, the big joints of the legs, they blow up like a balloon. Okay. And that's not from mechanical damage arthritis like we have in people. This is an infectious arthritis. Sometimes we see it with baby calves. It's different types of bacteria in those baby calves. Actually comes from, navel ill coming through the umbilical cord. But in kind of our weaning aged animals, it's secondary to pneumonia. So what we see a lot with these calves is, you got a group of calves in a lot or out grazing, and all of a sudden we have a bout of pneumonia. We treat them, they get better, and then a week, 10 days later, they're severely lame. It's like, what in the world is happening? Well, that is septic arthritis, and it comes from the same bacteria that cause pneumonia. However, it gets seeded, goes through the bloodstream, and actually gets seeded into the joints. And that's a tough scenario, but we need to diagnose those quickly because it's rest and recovery. It takes a long time for those septic arthritises, and many times we may just cull them. Okay, we may send those for, special slaughter, be able to have some salvage value recovered from those calves. So that's a different type. It's infectious, but it's in the joints and it's in the big joints. So that's where we differentiate issues in the foot, which is most common, but then kind of everywhere else. One of the other, infectious causes that a lot of producers may not have seen before is called hairy heel wart. And hairy heel wart's been around for a long time. It's been traditionally talked about in the dairy industry. But we are seeing quite a bit of hairy heel wart issues, or you might know it as strawberry foot rot. There's a lot of different names when it comes to hairy heel. But the hairy heel issue is we see an animal walking on the tip of its toe, on the very tip of its toe. It's so strange. And once we get a closer look at this animal, its foot looks normal. Okay, the foot itself, there's no swelling. But on the back of the heel bulbs, there might be these kind of red, abrasive type, almost hairy looking appearance wart lesions. It's a digital dermatitis, so it's a dermatitis on the skin itself. We don't fully understand how this disease spreads. We know it's infectious. However, it pops up at very strange locations. It will have an animal in a feedlot, been there for 200 days, and all of a sudden it's a week away from finish, and it comes up with a severe hairy heel lesion. And it's like, what happened here? It's been in the same pen for, the entire stay at the feed yard. Why now? So we don't understand everything about it. We think that it's caused by a spirochete bacteria. That's what we attribute hairy heel wart to. One thing we do know is it's not a deep infection. It just causes issues on the skin, which changes our treatment modality. If we just give an injectable antibiotic like we would for foot rot, it's not going to touch that hairy heel. So if we see those lesions on the back of the heel bulbs, we actually have to use topical application of some different therapies, and we can have quick turnaround. Those animals go from three-legged lame to walking completely normal in like a day. It's really rewarding, although it is very challenging once an operation has hairy heel. Those would be kind of our multitude of, and we didn't even discuss injuries.
I was going to hit on that one. It's like, do injuries increase with being slick the same as, everybody else falling on the ice?
Of course, when we have slick, we have ice. If we're doing some type of intensive movement on animals, if we're doing some type of different grazing or controlled feeding where we open gates and they try to, rush in to go get food. So any of those situations, when we have maybe frozen ground, we have ice, we have things that, right now we get hot, cold. So we have mud, which gets really slick, then it freezes overnight. So those environmental scenarios, anytime that really increases the risk of just injury.
Once again, that was K-State Beef System Specialist Dr. Jaymelynn Farney and K-State veterinarian AJ Tarpoff. We'll continue the conversation on winter lameness in cattle ahead on Agriculture Today. Tuned back into Agriculture Today. We're continuing listening to the conversation from K-State Beef System Specialist Dr. Jaymelynn Farney and K-State veterinarian AJ Tarpoff. They recently discussed winter lameness in cattle on Dr. J's Beef Podcast.
You hear a lot from producers saying, especially when they're trying to do self-diagnosis and everything, that calf will not put pressure on this leg, isn't walking worth a hoop, but I don't see any swelling in the hocks. I don't see any swelling around the foot. It's not foot rot. And, it's great that you were bringing up some of these other ones, and particularly that deep one that I imagine probably gets misdiagnosed a lot.
And they do. And it's something to just be cognizant of that if, we have these lamenesses and it's just difficult to diagnose, we treat these circumstances, we treat these diseases quite differently. So it's really, really important to make sure that we are treating effectively for whatever cause of lameness. We're going to treat foot rot one way, we're going to treat a septic joint very differently, and we're going to treat hairy heel even more differently. It's not just a regular treatment regardless of lameness. We do need to get a good quality diagnosis and then be ready for follow-up. Because if it's regular foot rot, when we treat them, they should recover rapidly. Within 2 to 3 days, we should have improving lameness score. So they should be able to walk much better. We see the swelling going down. After a couple days, if within 3 or 4 days after treatment, if we don't see rapid change of success, maybe something else is going on. Maybe we need to change our diagnosis. Maybe we need veterinary involvement to have some extra types of therapy to make sure that we get the animal back to production. Because lameness is a major cause of cullet decisions, whether our cow-calf herd, whether it's at our feedlot or our grower backgrounder. The majority of our railers in our feedlot and backgrounding facilities, lameness is a huge percentage of what causes those railers. They linger a long time trying to recoup value from some of that purchase value. But those are animals we, really need to stay on top of and making sure that we're not causing any problems, but we're trying to effectively control whatever lameness problem is happening.
You mentioned, treatment is very different per each diagnosis, and there's a lot of lameness deals, so I don't necessarily want you to say, okay, you have to treat with OTC or CTC with foot rot and da-da-da. Don't necessarily have to go into that much detail, but, if you had to rank the ease of solving or, fixing these lameness, when you should definitely just directly call your veterinarian if you think you have it, or what can be easily treated on operation. Can you maybe, rank that?
Thankfully, what producers are very comfortable with diagnosing is foot rot, right? Foot rot, the bacterial infection of a foot rot, is one of the more easily treatable lameness issues that we deal with in beef cattle. So when they have that infection, thankfully, we have numerous injectable long-acting antibiotics that are available on the market that even single treatments, a single dose, that will solve a case of foot rot, assuming that we don't have underlying structures impacted. So when we catch those animals early, right when the swelling begins, right above the heel bulbs, before those toes start to spread out, before we get a big clubfoot, when we treat those animals appropriately very early in the process, they recover rapidly. We can do it relatively cheap with an injectable antibiotic on the premise. Okay, so those, whenever we find them early, being prepared, having products on hand, working with your veterinarian under a veterinary client-patient relationship to make sure they have the products on hand, they know what they're treating for, and they know when to. So if they have facilities, we can get those early treatments. Hey, foot rot is easy to deal with whenever we catch them early. Unfortunately, the other types, the deep infections, the large septic joints, those are challenging. Okay, if we have a deep-seated infection in the foot, it's best to just call your veterinarian right away. If we try to treat them like foot rot, they linger for weeks and weeks at a time, where we could have done a different type of therapy, or maybe had to do a hoof trim and be able to pare out some type of infection. We can get that addressed right away to increase the successes of some of those scenarios. So if you see a deep infection, it's best to call your veterinarian. If you're unsure about what the lameness is, just back to proper treatment. If you don't know if it's foot rot, it doesn't look like foot rot, don't treat it as such. Make sure that we're getting a good diagnosis. It's worth a trip to the veterinarian to make sure that we're getting it appropriately taken care of. Or it may be something like, hairy heel warts or digital dermatitis you've never seen before that your veterinarian will be able to diagnose right away. Then after that, you know what it looks like. They've taught you what it looks like. You can effectively take care of that topically back on your operation if you have. So it's all a learning process. I think what producers are most comfortable with is foot rot. When we treat them early, they do really well. Everything else, it's almost worth a phone call, okay, to make sure that we're getting appropriate treatment and appropriate diagnosis. I think about calves and a septic joint. It takes a long time. We can get rid of the bacteria, but it takes a long time for those joints to resolve. I'm talking maybe a month or more. So it could be 60 days, it could be 90 days for that calf that all of a sudden, it doesn't gain weight. It really doesn't do anything for 60 or 90 days until it resolves that joint issue, and then it can go on. And some of them can, but having that realistic expectation, those are tough. And I understand they're challenging to deal with, but have your veterinarian involved with those decision-making processes.
And another portion, everybody immediately goes to the treatment, diagnosis and treatment. But how much of this, especially in the winter, can be prevented?
So much of what we see both during the summer and the winter months can be partially resolved or minimize their impacts by environmental control. And what do I mean by environmental control? No, I can't control when it's wet. No, I can't control when it freezes. But some of those key areas, what happens when a stomped out area of mud freezes? It is so rough, you can barely walk across it, in your mud boots, right? Well, imagine our animals having to walk across that to get to the water tank. When we do have those freezing and thawings, my go-to, probably the best useful implement in those scenarios is a box scraper. You can just, hook them up to the back of your tractor and run in there, do a quick lap, knock off all the sharp points. We're not making it smooth and slick. We're just knocking off the uneven areas where those animals can freely move from where they rest to where they eat to go get water. And we take that risk out of it. The other areas is ice. Just being cognizant if we're working animals, environmental control. We can't get rid of all the ice. We can't be out there with a flamethrower trying to melt everything. But if there's areas where there's ice, being proactive, putting down sand, making sure that we have good grit and abrasion so we're not going to have animals slip and slide. So cleanliness, making sure that any rough areas that we can level those off as much as possible, with the front end loader of a bucket, with a box scraper, whatever you have available. Any amount that you do management-wise to improve the animal comfort during those conditions, the better outcome we're going to have. I mean, winter, early spring, mud is common if you have moisture this year. Frozen ground, uneven, rough ground, even manure piles, right? We think about manure out in the pasture. It can be rough and frozen and animals stepping on it. Guess what? It can cause abrasions of the foot, allowing bacteria inside to cause foot rot. All of those things come into play, that anything abrasive, especially sharp pointy areas of frozen mud, if we can control that, we can greatly reduce some of the impacts of our foot rot issues.
And where does the bedding component or winter bedding play into lameness, the cleanliness, etc.? Because a lot of folks were rolling out, well, not so much this year because it was too expensive to roll out wheat straw to help keep your cattle very warm. They're building windbreaks instead with that expensive hay. But if you did have some, we're working to mitigate some of the other winter cold stress effects with your bedding, how does that impact lameness?
Bedding is phenomenal for lameness. The dairy folks that may be listening, they know this very well. When a cow rests for more hours during the day, they ruminate, they chew their cud, less lameness, right? So an animal should graze for a specific time or feed for a specific time, but it also needs a comfortable area to go lay down. And when we have environmental extremes, when we have very cold scenarios, when we have a bedded area, those animals get off their feet. They go and lay down. They're not in those rough frozen, trying to stand on those rough frozen areas. They go and lay down and they relax. When we have that, and we have that thermal barrier, a nice bedding area where those animals can concentrate into a nice, dry, warm area, they get off their feet, that is a positive benefit, regardless of that scenario. Whether it's out in the pasture, whether it's in a lot, anytime they can have that nice, comfortable area to lay down, to get off their feet, we reduce lameness rates. Does that mean you have to bed the entire pen to get rid of it? No, not necessarily. But just keep in mind just that nice area that provides thermal barrier from the frozen ground that's comfortable for the animal. Cows will find that and they will utilize it. Okay? So when given the opportunity, cattle will reduce their own lameness rates.
Once again, that was K-State Beef System Specialist Dr. Jaymelynn Farney and K-State veterinarian AJ Tarpoff discussing winter lameness in cattle. This conversation was borrowed from Dr. J's Beef podcast, which if you're wanting to hear more about winter lameness in cattle, an extended version can be found there. So if you're looking to learn more from Dr. J, be sure to check out her podcast, which can be found on any podcasting platform simply by searching Dr. J's Beef, as well as her podcast's website, which is drjaysbeef.com. Coming up next, we have Milk Lines for the Week from K-State dairy specialist Mike Brouk. This week, Mike is recommending producers evaluate the moisture and starch content of their 2022 corn silage to determine really if it met their goals or not. He says if not, they may want to consider making some adjustments for 2023. That and more is coming up ahead on Agriculture Today.
This is Agriculture Today. Along with Samantha Bennett, I'm Jeff Wickman. We end today's program with this week's Milk Lines. K-State dairy specialist Mike Brouk says that now is a good time to evaluate the 2022 corn silage crop, especially moisture and starch content, to aid producers in making decisions for the 23 crop.
Today I'd like to visit with our Kansas dairy producers concerning what have you learned about your 2002 corn silage crop. Many of you have probably been feeding it for maybe a few weeks or maybe a few months now, so we should have learned some things. So as we think about 2023 and we think about the silage harvest that'll come at the end of the summer, I think it's important to reflect on what we learned from 2022. So as we think about that, how's your silage team? Are you going to have the same team together that you had for the 2022 crop in 2023? If so, that's great. If not, maybe there's a little bit of extra training that needs to happen. So when we think about the silage team, that would be you, the owner of the dairy farm, or whoever is managing the silage crop for the dairy, whoever is growing the crop, and that could be the dairy, it could be other people as well. And for most of us, it's whoever is harvesting as well. So it's really kind of the three-legged milk stool idea that it takes all three to really make this a success. So let's talk about some of the basics. So did you hit the moisture goals that you had in 2022. You know, that corn silage should be testing somewhere between about 35 and 38% dry matter as you take it out of the bunk. Is that what's happening, or is it too wet, or is it too dry? If it was too dry or if it's too wet, what do you need to change in 2023 to make this more successful on your dairy? Remembering, cows respond to having the correct moisture content in the corn silage very well. So if we're not getting what we wanted, maybe we need to start with moisture first and get that right. Then we'll talk about some other things. Some of the other things you might consider is, what is the starch level? Did you hit the starch levels that you intended to hit with your corn silage? You know, as we talk to different producers and we look at this on a dry matter basis, the ideal starch level for corn silage, we'll see some variation there, anywhere from maybe about 35% up to maybe even the low 40s in some situations. Some of the things that impact the starch level would be, number one, the height at which we chop the silage. If we cut down 4 inches off the ground to get the amount of tonnage that we wanted, it's probably going to decrease the starch level slightly. Also, hybrid selection becomes part of this, as well as the growing season and also our harvest date. If we harvested a little too early, got that corn silage in a little bit too early, a little higher moisture, we probably are going to have a little bit less starch because grain development was less than it should have been. So, are you satisfied with the starch level that you're finding in your corn silage? If not, what are you going to adjust this next year? Does it have to do with target dates for harvesting based on plant moisture and grain development? Maybe it's a hybrid selection thing. Yeah, you may have already ordered your corn seed for 2023, but maybe have an opportunity to make some changes in that order. Visit with your seed dealer and see what might be possible. Maybe you need to try a little different hybrid than what you have in the past. Maybe you don't want to risk all your acres to that, but a portion of those acres to see if you can increase the starch level in your corn silage might be something that you would consider. Also, if you're irrigating, when we talk about starch, a lot of times the starch content that we find in the corn silage is really impacted by when we stopped irrigating. If we stopped irrigating a little bit too soon, the grain development may not have occurred the last 2 or 3 weeks as we would have expected prior to harvest. So you might need to take that into consideration. If you're dealing with others that are actually making those irrigation decisions, you need to visit with them and find out whether or not there might be something that needs to be changed there. There's a lot of other things that could have impacted the quality of your corn silage. Obviously, the weather has a major impact and something that we don't have a lot of control over, obviously. But if that had a huge negative impact on your corn silage, there's some things you might think about. You know, sometimes later planted corn silage, later in the growing season, shorter season, spreads out that risk. So if you risk everything with early spring planting, maybe you need to think about some of those acres being planted a little bit later to a different hybrid. Maybe that'll help you hit some of those targets. This is Mike Brouk with K-State Research and Extension, encouraging our dairy farmers to take a look at the 2022 corn silage and determine what they might learn as they move into the 2023 year.
Thanks, Mike. And that'll do it for this edition of Agriculture Today. For Samantha Bennett, I'm Jeff Wickman. This is the K-State Radio Network.